The numbers say it all. The daily COVID cases over a 7-day period is now below 250, a big improvement from January and early February's count of 800 daily cases. Testing has decreased as well, with a 7-day rolling average of 1,000 tests per day and a drop in test positivity from 40 to 23%. As for the age groups, all are showing a decline. Territorial Epidemiologist Dr. Pobutsky.
Symptomatic cases are now averaging less than 40% of cases, and we're finally now seeing a decrease in the hospitalizations and census count for COVID cases in the hospital since mid-February. There's also decline in the ICU.
COVID deaths continue to appear occasionally, with the island averaging at least one COVID fatality per day, but even that is letting up. Despite the encouraging numbers, the island isn't out of the woods just yet. Public Health continues to monitor the COVID situation, with lead epidemiologist Dr. David introducing a metric system to determine Guam's stance in the surge.
It's a two-step process, and where the step one is where we decide where we are in terms of transmission. And the cutoff here is 200. If we have 200 or more new cases per 100,000 population over the past 7 days, we are categorized as being in the high transmission category. And if it goes below 200 per 100,000 population, we then move to the low risk category.
Dr. David added once the island has determined if we're in a low or high category, we then look at the demand of health system capacity.
And here we look at new hospital admissions per 100,000 people over the past 7 days, as well as the percentage of staffed inpatient beds occupied by COVID admissions. So we no longer are going to be factoring in here the test positivity rate. So that is the major change.
And according to the new metric, Guam is still high risk in terms of transmissibility cases and health system capacity.
If you look at where Guam is, like I say, step one, we are still in the high risk category in terms of our COVID admissions and our staffed inpatient beds. One is moderate, the other one is high, but we go by the higher one. And so we are still at high risk, but trending downwards.
As per Dr. David, vaccinations and boosters continue to be our best defense against the COVID-19 virus. Daniel Perez reporting for KUAM News.